Dr. RP here once again from IWSO. Today I have got one of my colleague friends who is Dr. VT, who is an eminent pediatrician in this country. I thought I will rope him up today because of the hot news that has been going around regarding the Chinese pediatric infection that is all over the news. We remember way back in the year November, December 2020, there was a little bit of a scare regarding the similar kind of infection that happened. Unfortunately, we all felt the effect of it way back during 2021, April, March. Now, there is a lot of news that has been floating around, and my friend, Dr. VT, is an eminent pediatrician, as I told you. I'm just going to ask him a few questions which will enlighten us regarding the scenario here. Hi, Dr. VT, are you there?
Yes, I'm here, Happy.
Hi. Is it possible that you can come on video, or you're in office?
Unfortunately, I'm in the clinical area. I can't actually come on the video. Sorry.
No worries, yeah. That's okay. That's okay. Anyhow, now, VT, you have heard of this news regarding the viral infection that is widespread in China, which is occupying a lot of bed occupancy and stuff like that, especially in the pediatric age group. Can you cast some light on it, please?
First of all, before I start, I think I needed to make sure I explain to you and whoever is you're going to share this video with is I'm not a public health expert nor an infectious diseases specialist, but I'm a pediatrician who probably is following it because my clientele will be affected by this. That's probably, you have to use it as a news or information sharing rather than an expert advice. That's probably my disclaimer. Okay. And in terms of what you said, yes, it is worrying, isn't it, when you hear that kind of a news in the media, especially after the COVID, that all the wards are full with children with respiratory problems. It is worrying, but what we are getting from Chinese data as well as the WHO, CDC, UK, HSA, everywhere, I think the information what we are getting now is it is probably what one of the specialists described as a immunity debt. So probably people had COVID restrictions and they're not exposed to viral infection. They're probably currently exposing more viral infections and bacterial infections, and hence we're having a peak of viral diseases. The information so far, what we have data is that it's probably a mycoplasma, which is what people used to call as a walking pneumonia. I wouldn't use the word, but anyway, that's probably.
Let me stop here. What is mycoplasma?
Mycoplasma is a bacteria which is an atypical bacteria which affects.
Okay. So it's not a viral infection; it's a bacterial infection.
It's a bacterial infection. Plus, also there are other viral infections that is very common at this time of the year. We are seeing a lot of RSV infection, which is called as respiratory syncytial virus infection within the UK, and we had a peak slightly earlier than what we normally have, and the influenza peak hasn't come yet. But if people are interested in this data, there is a very good website, especially people who are in the UK, or if you want to have UK-based data, the national UK HSA a dashboard would give you a data that is up to date from the government. Every week, they would actually pick up the samples, they check them, and they'll give you data as to what is happening. The trend so far is we are seeing the RSV infection. Influenza hasn't peaked yet. Mycoplasma is not an issue in the UK as far as we know, and I think this is something to watch, not to panic, in my opinion.
So why has the media and everybody so much hyped up about the Chinese infection data going up? Is it a norm in all the countries, or is it just happening in China?
I think you can't trivialize any acute infection load in any country anymore, considering that we had a COVID infection. So people are actually being more cautious, and I think there's a general surveillance that is happening within the community to be more cautious about them. But all we can say scientifically is the data so far does not seem to be alarming, and there's been a press meet from the CDC head to the health officials within the government officials within the USA as well, which reassures the same. And I don't think we can panic yet, but I think having a little bit of surveillance and a bit of an alertness is not a bad thing, if you would ask me.
Right. Okay. So what are the which age group does this commonly affect, this particular infection?
I think usually around school going age group, but also in terms of the viral infection, it's much more younger age group. For example, RSV infection, it's usually less than 1 year affected more.
Yeah.
And it
I
is
saw
not
the
uncommon.
data from the
Sorry?
Chinese data stating that it affects less than 4 years old.
Yeah, it is not uncommon, because that is when the children are succumb to this viral infection. So I would say it is something to be watchful about. I don't think we can do anything about unless we get more data. Having said that, there are some data from Denmark and Netherlands coming through as well. Denmark data seems to suggest there are around 400 patients or 250 patients. I couldn't be exactly, don't quote me on that, with mycoplasma, which is slightly higher than normal. But again, it comes in waves. So you can't make a judgment based on what it is. And mind you, every single health surveillance agency in the world is not on, always on a high alert at this time. And they usually look for the variation and variance, genetic variation within these bugs, and they will alert us. So we need to have some faith in the system as well.
All right. Okay. So what symptoms are there and what's the treatment for this particular epidemic that has been seen? Is that you said it is bacterial, so it is going to be a specific antibiotics, is it?
Yeah, I think if it is mycoplasma, the antibiotics is going to be macrolides, which is usually azithromycin or erythromycin. But most of these bugs are resistant to that, especially in China. I think the last thing I learned was around more than 50% resistance there. But I wouldn't worry too much about it, because if it is mycoplasma, there will be a wave of it and then it disappears again. So I wouldn't worry too much about it. But again, we shouldn't be alarming the public. Because it's nice to focus on one thing, but it is not one thing. It's multiple things that is causing problems within this. Right. So, and again, we do not know what is the immunity having been protected from mixing because of the COVID. What is immunity for the younger population and how they are coping with it? We do not know. So it could be a reaction due to COVID isolation, which is prolonged in China. We all know compared to rest of the world. So it could be that. And there is some, so, as I said earlier on, one of the specialists has coined the term immunity debt. So it could be that they are having that. So we do not know. I think at this point of time, it's a winter. Most of the cold countries will have viral infections, significant viral infections going through. And let's actually watch the space and not panic, if you ask me.
Right. Okay. Are there any specific preventative measures that are that you would advise as a pediatrician to the parents of the kids?
I don't think I need to be a pediatrician to advise that. We all know from the last COVID, hand washing, keeping a face mask do actually prevent some infection. So I think if you're worried, if you have a cold symptoms, have a face mask. If you are not feeling very well, don't go to work, and actually observe the common hygienic practices, washing your hands, etc. So that should be adequate, I would think.
Did you see about the neighboring countries of China, like our India, Burma, Nepal, Bhutan? All the governments have placed screening measures and have advised wearing masks in the airports for the people who are coming from other countries. Any ideas or any opinions on this?
I think that's a very common thing and common sense thing that one should do. Really, I don't think I would actually read anything more than that, because there is some unknown quantity, something that is being on the horizon. You want your population to be safe, and you want the population to be safe where they are mixing very much so, especially airport and things like that. And also when people are coming in from other countries, you want to do some surveillance. So I think it's a measure that any sensible country with a good health system will do. So I don't think I would read anything more than that at this point of time. Again, what we are talking about is a snapshot of an opinion, not necessarily a well-considered database opinion at this point of time.
All right. Did you have a look at the WHO data regarding this? They have acknowledged that the Chinese people have given the data. They have released adequate information, and they have given some information regarding that as well. But once again, as you said, there's nothing alarming at this point of time. So hopefully, I think we need to keep the space watching. I hope we not end up in any new surprises like the 2020 or 2021 stuff. Any general advice from you, VT?
I think the general advice is if you are unwell, don't go out. If you have cold symptoms, have masks if you can tolerate them, especially children. Adults do the same thing, and hand wash, hand hygiene, basic hygiene. I think nothing more than that really at this point of time. And I don't think we should actually worry about it. I think most of the governments have learned from the COVID, and the memory is still very raw. And I'm sure that people who are actually well placed within the organization are doing the right thing.
What is the incidence of mortality in this epidemic that has been happening?
I think that's too far-fetched for me to answer that. I can't answer that question. I think that is we are talking about a very clear data. I don't think we can answer that question. I think it's a bit too much to answer.
Right. Okay. But in general, nothing too much to be worried about, nothing too much to be panicked about at this point of time.
If you're asking from a friend point of view, should I be worried about VT? Should I be worried about these things? I think you wouldn't. But if any cold or cough, if you have your children gets it, you would be worried about it as a parent, of course. And but I think let's actually let's also assume that our children do have immunity and they have a general basic health better, then they will cope with it. So most of the children do cope with these things very well.
What is your advice regarding improving the immunity in this set of people? Any advice?
No, I don't think I have any specific. I wish if I had the advice, I would have a different company on my own name. I don't think we can actually do that. I think nature has its own tale of telling us how to improve our immunity. I think let's actually follow that.
Right. Okay. VT, much appreciated, man. I might be bothering you time and time again for giving some expert opinions. And also, I have rekindled our IWSO. I would appreciate if you can pitch in at the time of need if any specific questions comes from the pediatric side so that you can offer expert opinion and advice on that. Is that okay with you?
It is fine. Just I wanted to mention that it's again a disclaimer. It's a professional conversation. It is not an expert advice, and I hope that's taken in that way. It's more to inform people, not necessarily
exactly
expert.
I have also placed a disclaimer stating that we are not here to offer any treatment or anything at all. We are here to give guidance to the people who have already got an opinion on the treatment. And if they want any clarification, we are there to pitch in to try and help them out.
Okay.
Yeah. Fantastic, VT. Have a nice weekend. Thanks, Rodman.
Pleasure. Bye.
Bye. Yeah. Take care. Bye.